Life is changing in Australia as it is changing all around the world. Life is going to continue to change as we deal with the global coronavirus.
Please know how serious this is.
March 2020, and the world as we know it is radically changing. Locally, the threat of COVID-19 is real, and so begins a response and readiness regime by the local health district like no other. With positive cases increasing here and across New South Wales, the district had a strong and clear focus.
Being nimble is the key, and we need to adjust rapidly to what may be a significant surge in people presenting to our emergency departments, needing beds and needing increased ICU capacity, and that is what we are working on every day.
By the end of the month, hospital visiting hours were restricted, COVID screening and temperature testing at sites implemented, outpatient consultations turned virtual, and non-urgent elective surgery was stopped.
This will free up staff that are usually working in or supporting in theatres and delivery to enable them to have time to train to develop intensive care skills to enable us to achieve double the capacity that we currently have.
Some of which already had intensive care nursing skills, others had none, and they have been and are still going through an intense training program to ensure that they are ready and able to look after intensive care patients safely.
We have identified 2 other areas that can be opened up in a stepwise fashion in order to deal with further people that may require critical care services.
We are continuing to run our mental health services. We are continuing to provide acute, rehab and subacute inpatient services. We are continuing to provide all of our community services.
The local community rallied to support staff and hospitals, including the Tibra Capital Foundation, donating $250,000 for equipment.
At this point, we're all, I think, pretty glad to be healthy and employed, but to be able to contribute like this and to support the hospital really gives us meaning in an otherwise pretty helpless time.
Adding 9 ventilators to our fleet has enabled us to not only open up our second ICU, but now we can move forward to opening up our third ICU with the knowledge that we have ventilators for the beds for the patients that need it.
By mid-April, more than 7,200 Illawarra Shoalhaven residents had been tested for COVID, including at dedicated screening facilities established at Wollongong, Shell Harbour and Shoalhaven hospitals.
A lot of our confirmed cases have actually come from overseas travel, and that's died off in the last few weeks, the number of cases, and part of that's because of the public health measures that we've implemented, and that includes social distancing, really good hand hygiene, and also intensive contact tracing and case identification.
We are increasing testing and screening more people than ever in our community. Our service planning, PPE logistics, our workforce redeployment and our ICU capacity building very much continues, as we know the journey in the pandemic response has only just started.
Local information and advice was stepped up, and just weeks after being established, the district's Facebook page saw a community reach of more than 120,000 people.
Ciao, io mi chiamo John Paul Troiani.
Guten Tag, mein Name ist Dr. Alexia Pape und ich bin heute hier.
您好，我是 Dr. Jenny Chen， 卧龙岗医院的陈医师。
By May, COVID tests in Islett had almost doubled. Community restrictions were being eased, elective surgery was being reinstated, and work continued to build intensive care capacity and COVID wards.
That included going from a 18-bed capacity to now a 46-bed capacity with the development of ICU 2, which we're now standing in. ICU 2 is a non-COVID ICU. ICU 3 is a 20-bed unit, which currently is set up to a point where it is able to be deployed and set up to take patients into it. The process of mobilising to expand our capacity has been a huge feat.
The staff can be immensely proud of all the work that they've put in to make this a safe place for patients, and also all the hard work that's been put in to make this place a safe for the staff to work in.
Being able to be there for our patients, we are their connection to the outside world while they are here on the ward or in the hospital. So we looked at different ways of communicating with our patients, making sure that we addressed all their needs.
We've now been ramping up our surgery to try and get back to our usual level of elective surgery. If we need to have a surge capacity, we will reduce our elective surgery back to just essential surgery. That frees up space within the hospital to create an additional intensive care unit.
This hospital has provided for the community a facility that really was good before, but now will be better for COVID, but also better into the future. We now can look after infectious style patients much better than we could before.
By the end of May, funding for additional positions in allied health and to boost mental health services was announced.
For ISLHD, our share of this funding means we can now focus on 5 key areas: inclusion to the statewide mental health access line, an expansion of the frequent attenders ambulance program, the development of more diversional activities for our inpatients, more clinical staff for our community sites with a focus particularly on vulnerable people, and lastly, the expansion of virtual mental health services. All of us are balancing a return to business as usual with maintaining our COVID readiness. I want to thank staff at Shoalhaven Hospital who are now back at 100% of their normal surgical caseload. This is an amazing effort by all involved. Well done.
By mid-year, the organisation was able to harness the many opportunities provided by COVID to try new models of care, including the use of technology and the fast-tracked implementation of virtual community care.
Our district has joined forces with the Southern LHD and Coordinator to pilot a program that will enable clinical teams to develop tailored patient care across a large geographic boundary.
Thanks for joining us. There are 5,696 cases of coronavirus in Victoria. That's 363 new cases.
So everybody will be a little bit anxious at the moment, seeing what's happening in Victoria. What we know at the moment is that there are a few cases down there and they're sort of ramping up over the last week. There are a lot of unknowns ahead of us. However, the truth is that we're far better prepared than we were 3 months ago when we first faced this.
Staff in our public health team are assisting their Victorian counterparts with contact tracing, but also now confirming our rapid response plans should community transmission cross the border.
There's a clear and present danger from COVID. It hasn't gone away. It's clearly evident from Victoria that a small number of cases can turn into a large number of cases quickly. But if that does happen, people should know that the hospitals are well prepared.
With new outbreaks appearing on the outskirts of the local health district by August and the heartbreaking devastation seen in aged care facilities both in Victoria and Sydney, even more attention was placed on the district's support of local residential aged care facilities.
We know that just one case in an aged care facility can lead to disastrous and tragic consequences. It's for this reason that the local health district is taking the lead on bringing together every aged care provider in this region to work collaboratively to strengthen prevention and preparedness.
Even though each of the more than 40 homes in this region are managing their own affairs, in an emergency, it will be our relationship with our local public hospitals and public health services that will matter most.
It's unique that we're seeing this collaboration, but it's something that I think we will continue to do post-COVID. It is a strength of the Illawarra and a strength of the openness that we are to share these plans and be ready.
September and October are slowly seeing a return to life as we know it, but for the local health district, work continues.
It's important that we keep these efforts up and that we work hard to maintain our current level of awareness and responsiveness.
For many, it's been an especially tough time. Drought, bushfires, floods and COVID continually testing strength and resilience, particularly in the southern parts of our health district.
Because for a lot of us, it sort of feels like this year's just been one long crisis. We set up the wellness program for staff, a supportive program to give staff the opportunity to learn the various skills and coping mechanisms that serves them not only through crises like the bushfire emergency or the current COVID emergencies, but the normal day-to-day stress.
So I was actually on shift during the fires and felt quite stressed. As you would imagine, I put on the responsibility hat and did what I did to the best of my ability, but post-fires, actually the cracks started showing in my home environment at work. Being part of this program, it's changed my leadership, but it's also changed me as a mother in the home, as a partner to my husband, and how to support my colleagues.
We would just like to give our heartfelt thanks to the hard work, the dedication and the compassion of all our staff, regardless of what classification they are within the organisation. We came together as a team. We will move on through this period of COVID as a team, and we will be able to achieve amazing things like we already have achieved.
What we've learned both personally and professionally, how we've managed and why we keep coming back each day should motivate every single one of us. We should all embrace a renewed sense of hope as we reflect with pride on what's been achieved in the face of adversity.
Finally, as we head toward a COVID Christmas, take some time to reflect on the year that was.
Remember, stay vigilant, keep distance, wash your hands, and if necessary, get tested.